My goal for my patients is not to give them a brand new Hollywood smile unless that's what they want. If they want that, we can do that for you. My goal for my patients is that when they're 95, they've got their teeth and they're not wearing dentures. Nobody wants to wear dentures, and no one plans on getting dentures, and then it happens, and we make dentures all the time. So I like to explain to my patients why people end up with dentures. If you look at this x-ray, this lady's in her 50s. You see this tooth, she's got really nice bone all around her teeth. You need good bone to hold your tooth in place. If you look over here, this dark area is where she's lost all her bone. She's got just a little bit of bone left here. She's lost most of her bone. You lose your bone, you lose your teeth. Why did she lose this bone? The reason why is she didn't take very good care of her teeth and she hardly flossed for 30 years. Why do you lose bone if you're not flossing? The bacteria or germs in your mouth like to do one thing. The bacteria like to eat whatever you like to eat. Let's just say that you had pancakes for breakfast and there's little bits of pancake in your mouth. The bacteria eat the pancake. When I ask my patients, do you know what bacteria like to do? The common answer I get is they'll say, bacteria like to eat your teeth. Bacteria don't want to eat your teeth. Bacteria want to eat the stuff that we like to eat. So the bacteria eat the pancake or the food in your mouth. The bacteria digest the food. And then we tell the kids that the bugs are pooping. That's what you and I do. We eat pancakes, we digest it, and then we go to the bathroom. You and I do something very similar. When we urinate, in our urine, there's uric acid. It's acidic. That's why when your dog urinates on the grass, the dog's not watering the grass, the dog's killing the grass. Eventually, the grass turns yellow and brown because it's acidic and it kills the grass. So it's this simple. You brush twice a day, you floss once a day at night, and more than likely you will keep your teeth for the rest of your life, okay? Now, I highly recommend the Sonicare or the Oral-B toothbrush. Electric toothbrushes are more effective and efficient in cleaning your teeth. When you use your toothbrush, what you want to do is you want to hold the bristles at a 45-degree angle towards your gums. And you want to go in circles and brush gently. In particular, if you're using a manual toothbrush, you want to make sure you have soft bristles. But let me show you how to floss properly, because a lot of people don't know how to floss correctly. Put your hands together like this, just like that. You take the floss and you're going to wrap it around your middle finger, okay? Then you can hold it with your thumb and index finger like this. A lot of people tend to hold it with their index finger, but wrap it around your middle finger. You can hold it like this. And you want to break through the contact, pull on one side. It's called C-shaped flossing. Go up and down, 1, 2, 3, 4, like that. Push against the other side, 1, 2, 3, 4. What a lot of people do is they just come in and out. You do that, you've completely missed the sides of the teeth where all the food and the debris is, okay? Another thing some people do is they go back and forth like this and they think they're doing a thorough job and they'll be super clean just right. It's where it's rubbing, but you're not really cleaning well. Another thing some people do is they pull up on each side one time. And that's kind of like if you got something on your hands, you go to the sink and you just kind of wipe one time. What we do is we scrub our hands, right? So same kind of thing. When you're flossing, what you're doing is you're cleaning in between the teeth. If you're only brushing, a tooth has 5 surfaces and you're only cleaning the front, top, and back. What about the sides? There's 5 surfaces. So you're only cleaning 3 out of 5 surfaces. And that's why flossing is so necessary. Because where do a lot of people get cavities and where does a lot of the gum disease start? It happens in between the teeth because people are not flossing. So again, it's that simple. Brush twice a day. Floss once a day. The reason why I like to go through this with my patients is that I had a great dentist growing up, and I'm sure they told me to floss. I hardly ever floss. I used to floss like the day before I went to see my dentist. I started dental school, my gums were bleeding, I just thought it was normal, and once I learned why this happens, I've been flossing ever since, and in the last 20 years, I think I've had like 1 cavity. So that's why flossing is that important.
Wow.
Any questions?
Thank you for the information. I've never had anyone explain to me how to floss like that. Thank you. Very helpful.
Awesome.
Appreciate it.
Great job. You got this. All right?